Hello, everybody. Welcome to today's podcast. I'm your host, Dr. Harshita, and today we have with us Dr. Lal Daga, a distinguished senior interventional cardiologist at Apollo Hospital, Ahmedabad, and Apollo CVHF Hospital. He also owns and practices at Dr. Lal's Heart Center. Dr. Daga boasts over 23 years of extensive experience in the field of cardiology. And today we'll be delving into a pressing health concern that's impacting young adults worldwide: the rising incidence of heart attacks among the youth. Welcome, Dr. Daga. It's a pleasure to have you here with us today.
Thank you.
So, Dr. Daga, I recall from one of your podcasts that you mentioned that disease tends to appear a decade earlier in Indian population. So the first question that comes to my mind is, what factors do you believe are contributing to the rising incidence of heart attacks among young adults?
So, Dr. Harshita, first, I thank for giving the opportunity to me. There was one study called Inter-Heart Study carried out by Dr. Salim Yusuf. It was done in more than 40 countries actually. Then the data they got it, they found that South Asian countries, particularly, the people get the heart episodes or heart disease episodes, acute heart attack, almost 1 decade prior to the Western population. The causes which were proposed after this data was like, one thing was like genetics, second thing was small coronaries, third thing they proposed was the dietary habits. Because in our part of the world, we usually have a carbohydrate prone diets, simple carbs, more sweets, more rice, and all those things. That was the one commonest cause. But genetics can be influencing because our average age of life is around 70 years. If you go to Japan, it's around 93 years, and in US, it's around 86 years. So that difference is there.
Doctor, early intervention is crucial in heart attack cases. So, what strategies are in place to educate young adults about recognizing symptoms and seeking prompt medical attention?
So, why it is important? That is the key point. So, in cardiac, we say that time is myocardium. Because if you intervene it early, you can save the myocardium almost 100%. So, if you miss it, then also the repercussions can be lethal. Patient can die also. So that is why it is utmost importance is given in medicine to the cardiology. Because if any acute heart patients is attended timely, it's not only the life, you can save everything. But at the same time you miss it, the patient can lose the life or he can lose the myocardium significantly. And why this issue is very important, because even in the developed world, they are not able to achieve the desired results in the patients. So there are so many issues for the patient to reach to the particular center or tertiary heart center or to get the timely help. The helping issues arises from the home itself. Who attends to you, who gives the primary treatment to you, then who carries the patient to the right place, because you are in the primary center, or if you lose more time in the logistic, by the time any complication can arise. It can be in the form of arrhythmia or sudden cardiac arrest, and patient is not attended. So patient can lose the life. So time is the key, number one. Number two, awareness is the key. Most of the time, it's not necessary, but most of the times you can get the symptoms which are precursor to the heart attack. Those are like chest heaviness, breathlessness, uneasiness. Those are common symptoms, but sometimes you can get atypical symptoms like shoulder pain, jaw pain, toothache, then backache, or upper epigastric pain. Even 10 to 11% patient can get upper epigastric pain. That is neglected as an acidity or gastric reflux disease. And even sometimes it is missed in the hospitals also. That's an unfortunate part. And they are not done the ECG also. So those are the awareness or key awareness point where you can attend them timely you can diagnose timely, and you can give the ultimate treatment to them. If it's tertiary hospital, then you can give the ultimate treatment in the form of coronary angiography, or you can save the myocardium. If it is not tertiary center, it is not equipped with the cath lab, still you can give them antiplatelets, or nowadays even thrombolytics are also available. If you are staying in the remote area where your MD doctor within the ICU setup, he can thrombolize, and their success rate is also 80 to 85%. Then they can go for a facilitated angioplasty. And that almost the success rate is nearby. Ideally, it's better that patient reaches to the tertiary heart care, he gets the immediate treatment, door to balloon time. That is what we say. Patient reaches to hospital, and your door to balloon time should be as minimum as possible to get the 100% myocardium.
Yes, Dr. Daga, thank you for your insights. And could you please elaborate on the role of lifestyle modifications such as diet, exercise, stress management in preventing recurrent heart attacks among young patients?
Yeah, and that's very important because what we eat, what is our lifestyle, that is the most common cause rather because for the acquiring these diseases. So these first causes which we can handle ourselves, those are very important because genetics is not in your hand, age is not in your hand, sex is not in your hand. Whatever you got from your parents, you are going to stay with that. But the diet is something which you can take care. So how the diet affects? There are two things. One in the form of calories. If you take more calories, it's like a currency system. How much money you got, how much you spend. At the same time, how much calories you got, how much you spend. Second, the nature of diet. So if you have heard about the term like glycemic index, some of the food with high glycemic index with high calorie, like if you eat ice cream, you eat sweeteners, sweet juices, those are like immediately give the calorie shoots and give the transfer of calories almost 100% in ice cream, sweets and sugar. But if you eat complex carbs, proteins and other things, then there is a glycemic index is on the lower side. Calorie intake is also low and glycemic index is also low. It takes time to get absorbed. Your fulfilling time is more. So that is how you can skip the calories as well as the calorie shoots. Rise in the calories, rise in the sugar in blood. So those are damaging. So diet is something which you can do lot of things on. For the fulfilling part, you can use more vegetables, salads, buttermilk. Those are less calorie items with fulfilling effect also. So that's the thing. The another thing is like particularly in the Indian scenario, we eat lots of like samosas, kachoris, fried items, and all those things are like with trans fats. Trans fats are most harmful because they almost releases like toxins and they causes like fatty plaques. If I just make it to the directly to the patients, I always say, ये जो घी है in Hindi language, ये जो घी है आपकी नलियों में जाके जमने वाला है. So trans fats is going to get deposited in your coronary. That is how I tell the patients directly. So trans fats are very bad. So what you can use is like omega fatty acids or these polyunsaturated fatty acids in the form of like olives and fish, and those things are for unsaturated fatty acids. And another thing is monounsaturated, like you can use peanuts, that's better. Almonds, then walnuts, these are the better items for this. And they are protective also, they increases your HDL. So diet, their diet can contribute to give you the good cholesterol. That's protective.
Yeah, excellent insights, Dr. Daga. And now for young heart attack survivors, what medication or therapies are typically prescribed for secondary prevention, and what is their long-term impact on overall health?
Yeah. So secondary prevention is also equally important because for the primary prevention, you can avoid the disease. That is always better. Like prevention is better than cure. So you don't get the disease, you don't need all those things. But once you got the disease, so the first thing comes like timely treatment, timely solution of that disease. Then afterwards, you have more probability to get the disease. the one person who didn't get the disease, on the another side person who got the disease. So who got the disease, he get 3 times more risk than the first patient who didn't get the disease. Further also, so the secondary prevention is very, very important. So he should not get the further recurrence, further episodes. For that, what he has to do? He has to be in regular follow-up. Now he is aware about the disease. So his lifestyle, diet and medicine should be more regularized. So he should follow the diet. He should do the modification of the lifestyle in the form of proper sleep time, less stress, regular medications, regular follow-up, regular tests. So India is the capital of diabetes also. And almost closer is hypertension also. Those are the risk factors: diabetes, hypertension, obesity, dyslipidemia. So you have to keep a watch on that also. So if you control all those things, your chances of getting further episodes becomes very less.
And doctor, can you tell about medication and therapies, like what medication are prescribed?
So I cover this answer in such a manner like it's a management part.
Okay.
So in our science, as you know, the management part consists 2 things: diagnosis and the treatment.
Yeah.
Nowadays you can add on like rehabilitation part also. So diagnosis, the early diagnosis is the key. Early diagnosis starts from the clinical symptoms. If you are aware about the symptoms and sign, you can catch it early. So if you think you are getting abnormal symptoms in the form of chest heaviness, breathlessness, fatigue, all those symptoms, if they are due, you can go to the doctor, you can go to the cardiologist, you can get it detected, number 1. Number 2, you should work up on your body in the form of diabetic assessment, hypertension assessment, cholesterol assessment. If you find any abnormality, you should correct it. Third, if your family history is there, then you should work up. So these are the basic things. Then it comes like after the evaluation by the cardiologist in the form of ECG, echo, TMT. We can do the biochemical markers, like where we can see how prone this patient is to develop these disorder, how prone he is to develop the heart attacks. So these are the commonest cause because atherosclerotic episodes are the most common. There are other causes also where these prevention doesn't help. Like in young women, there is a cause called spontaneous coronary artery dissection or intramural hematoma. It is called like SCAT or fibroblastic dysplasia, then intramural hematoma, where these prevention doesn't help. But they are very few in number. So there are some abnormal causes also. But the most common cause can be helped by this awareness. So first thing, our common things are by the symptoms evaluation, then cardiologist approach, then ECG, echo, then TMT, then biochemical markers that we can do in the form of lipoprotein A, high sensitivity CRP, apolipoprotein B, serum homocysteine. These are so many markers. There we can go and specifically do it. Then there are formats like risk scores, ACC risk score, Framingham risk score. There we can get the probability of getting the heart disease. So we can be little more specific. What the problem patient has, how much is the probability. So then we can judge how intense the treatment is required to the particular patient. So that is the part of diagnosis and assessment. Third, once the patient got the disease, we treated these patients by these medication, controlling the risk factor as well as the disease, heart disease. Then the medicines in the form of antiplatelets, those are blood thinners, cholesterol lowering drugs in the form of lowering the cholesterol. Then if the heart function is compromised, then there are some other drugs which take care of your heart failure or heart function part. Then there are other medications which decreases the stress on your heart like beta blockers, ACE inhibitor. Then you work on comorbid factor in the form of diabetes, where you control the diabetes. So you contain one risk factor. Another is like hypertension. So those, if you do at the same time, you can take care of almost 95% patients. Very few patients may behave miserably, definitely, because genetics and other causes may be there. Then the compliance part comes. Then the other factors are also there because it's a polyfactorial disease, where now it is proposed like pollution and other things are also there.
Yes, Dr. Daga. And now, considering the unique challenges of managing heart attacks in young adults with comorbid conditions like diabetes, obesity, and autoimmune disease, what strategies are available?
Yeah. So if you talk about strategies, I work in Apollo Hospital and I found a very good thing over there. The chairman of Apollo Hospital is the largest chain in Asia, and the chairman himself is a cardiologist actually. So what he established, and even Apollo is known for those health checkups, where what they do is they do this workup on each and every patient who comes for these health checkups. And he made it very economical also. And by this, there are so many patients we get frequently that his diabetes is diagnosed first time, hypertension is diagnosed first time, or some patient definitely get cardiac assessment also. So these are the patients where the damage has not been done yet, and you diagnose it at a very early stage. So if you diagnose something at the age of 35 or 40, and if you prevent it, or if you manage it with the drugs for next 30 years, 35 years, then the purpose is solved. He didn't go for any heart attack or any other thing or any other complications. So these regular checkup is very important for what I think, and particularly if your family history is there. Family history, there are two sides. One is paternal side, second is maternal side. Then the third thing, if you have any comorbid things, then any abnormal blood tests. And if you find your stress level is very high, your regular sleep cycle is not there, you are very ambitious type A personality, if you are prone to smoking or some substance and all those things, those are also very common in young people nowadays. So if these things are there, then definitely you should get it checked. In a Western population, they recommend after 40 years, every year the patient should get investigated. But particularly in Indian scenario, we see many patients in 20s, 25, 30. So I should say the first checkup should be within the second to third decade in between. And after 30, they should go every year.
Yeah, and finally, in your extensive experience, what are the key takeaways for healthcare providers and young individuals alike in addressing the growing issue of heart attacks and improving prevention and management?
So healthcare providers are the key actually everywhere. Because if I'm a cardiologist, there are maybe 5, 6, 7 cardiologists in a big hospital. But hospital itself is huge and you are busy almost the places. Hardly 2 or 3 cardiologists will be there. So healthcare worker in the form of like paramedical staff, nursing staff, and assisting doctors, assisting residents, all those, they are the key. Even sometimes these episodes are noticed in the hospital itself. Another thing is like any hospital of 200, 300 beds will be having employees of 700, 800, 1000. So they can make a big difference. They will be staying in societies, they will be working in colleges, schools. Like you are a doctor, how much difference you are making? Like you are making these podcasts and video, it's going to thousands of people. It will be spiraling into further thousands of people. So that is how you are contributing, because you have been through this branch. That's why you are aware and you have chosen something which is helping the masses. I'm being from this branch, I also think in the same manner. So that's the same way any person who's working in the hospital, if he is made aware what you can do. So the first thing he can do is about the himself, then the second is the family, third is the community, then the surrounding society or nearby area. These are the part in the form of social education. Another thing what they can do, at least they should be aware about the CPR and primary help. If any episodes happens, everybody will go to them that this person is working in the hospital, he will be knowing those things. So he should know what the primary treatment is given in the case of acute heart attack. He should know about what the discipline is, what the sorbitrate is, what the clopidogrel is. Then he should know about the CPR. There are many countries nowadays where any place which has a mass gathering, or any area where the like malls are there, or the big events are like event theaters and all places are there, where they keep these defibrillator and the things for the CPR purposes. So they should be aware what to use, how to do it. So now there are so many videos are also available. There are so many courses are also available for paramedical staff. So they should know what is the basic life support, What is the advanced cardiac life support? Then another thing which is important, by the time you do these primary things, you should seek the help also. You should know the number of ambulance. At least you should know where the patient can reach as early as possible, where he can get the right treatment. So healthcare provider, I think they are the key, and particularly country like us, where almost every fifth person is staying in India, and almost 60 to 70% area are still devoid of these emergency services or tertiary care services, where the role of us is very significant and very important. It can make a big difference. So education, timely help, all those things can be provided by healthcare provider, because everywhere cardiologists cannot reach.
Yes, doctor, thank you so much for your expertise and insights on this critical topic. And we hope this podcast will contribute to a better understanding of young heart attacks and inspire positive changes in prevention, diagnosis, and management.
Yeah.
Uh,
So nice to talk to you, Dr. Arshita, and I think it will be helpful to each and everyone. Anybody who is having any query, he can mail me, he can talk to me. My details are available in social media. I will be more than happy to help them. Either they are here or they are out of country. Thank you.
Thank you so much, Doctor. And now, as we wrap up today's session, a huge thank you to our audience for tuning in. And before we conclude, I want to bring your attention to the MedSynapse platform, our vibrant hub that's redefining the healthcare landscape. It serves as an invaluable resource for professional doctors like you, offering opportunities to engage in meaningful discussions, connect with expert doctors, and be part of advancements in healthcare. Why wait? Explore the MedSynapse platform right now to make the most of these remarkable opportunities. Feel free to drop your comments in the section below. If you have any questions, we'll be more than happy to provide you with the answers you seek. Until next time, take care, keep advancing in your medical journey. Goodbye.